Adolescence is one of the hardest times in anyone's life. Social pressures, physical and hormonal changes add to everything else the desperate need to seem cool. TGMC would like to discuss how teens and young adults can actually damage their long-term health with decisions they make today, and how organizations such as the National Initiative to Improve Adolescent Health can help parents and teachers educate their youth of dangers today.
All right, welcome to Your Health with Terrebonne General Medical Center. I'm Martin Falls. Joining me tonight, Dr. Joni Clayville. And there she is right there. Dr. Joni, welcome aboard.
Thank you so much.
We appreciate you being here.
Glad to be here.
All righty. First of all, what age group would you consider to be a young adult?
Well, anyone between the ages of 10 and 24 fall in the category of adolescents and or young adults. The group is further subsegmented into the 10 to 14-year-old age group, the 15 to 19-year-old age group, and then we have the 20 to 24. The highest mortality rate that we find is within the 20 to 24-year-old age group, which is the college age group.
Okay. Why do you think there's a concern for that demographic?
Well, an astronomical number that we see in 2003, 71% of deaths in this 10 to 24-year-old age group were caused by preventable occurrences, things that could have been avoided, unintentional injuries, homicides, suicides. And that's why we target this age group. Lifelong conditions and habits that we develop at this age group actually affect what we do or how we live the remainder of our lives.
Okay. Now, the biggest risk that are endangering the young adult health, what do you think some of those factors are? What would it be?
Well, a few things that we've found is mortality, motor vehicle accidents, motor vehicle deaths. Studies show that 35% of deaths in young adults were caused by motor vehicle accidents. 35% of the deaths, drinking-related deaths, pranks and stunts and peer-influenced activities, reckless driving. So certain things that we can do, simply wearing a seatbelt, not drinking and driving. And some young people say, hey, I don't drink and drive, but not riding with someone that's drinking. Those are some things that we can do ourselves. Other things, violence and gang involvement, homicides, carrying weapons, those kinds of things. In 2009, this is from the CDC and some of the Department of Health and Hospitals as well. 32% of high school students had been in a physical fight within 12 months prior to this study. And 2 out of 10 high school students actually had carried a weapon to school with an intention to use it during that time. That's astronomical to me. Then we also go further into mental health and substance abuse, depression, suicide, drug and alcohol abuse. And we have illicit drug abuse. Marijuana is still the most common illicit drug that is used in our young people in the U.S. Although that rate is decreasing, we have increasing rates of prescription and over-the-counter drug abuse, synthetic marijuana abuse, those kinds of things that we see in the emergency department a great deal. A study that I found was in 2009, 20% of U.S. high school students that had ever taken any of these prescription drugs, OxyContin, Adderall, Vicodin, Xanax, these high school students had taken them without a doctor's prescription.
Wow.
Without a doctor's prescription. Now, I know that these drugs are required sometimes for pertinent medical conditions, but these 20% of high school students, 2 out of 10 had used prescription drugs without a doctor's prescription. And we are also seeing a lot of the over-the-counter meds. Teens are using the over-the-counter cough and cold meds, dextromethorphan, to get high. And I think that one general consensus that we have to make the public aware of is that because prescription and over-the-counter meds are legal, they're not always as safe And we have that perception that because they're legal, that they're safe, and that's not always the case. So you have serious health effects, addiction, and even death that can be caused. Then we go into reproductive health, unprotected sex, sexually transmitted diseases. Louisiana still ranks number 1 in cases of syphilis, number 2 in cases of gonorrhea, and number 3 in cases of chlamydia. So we have that and HIV as well. So, and in 2010, we had 1,200 new diagnosed cases of HIV in the state. So, and other chronic diseases that are caused by tobacco abuse, obesity, and diabetes, those are also there.
Okay, very interesting. What we're going to do, we're going to take a break. When we come back, we're going to be right back with Dr. Joni Clayville. It's all next on To Your Health with Terrebonne General Medical Center.
Put together a crew of top specialists, and you can do amazing things. Cardiac care at TGMC. It all begins here.
My husband and I have known each other since high school, and Bobby and I are very close. When I started losing my hair during my cancer treatment, he volunteered to shave his head too. My name is Sherry Starkey, and in 2007, I was treated for breast cancer at Mary Bird Perkins. 2 different doctors recommended Mary Bird Perkins, and everybody there was fantastic. And I know being close to home and family really helped a lot too. I'm still here, and Mary Bird Perkins had a lot to do with that.
Mary Bird Perkins Cancer Center at TGMC.
All right, welcome back. Dr. Joni Clayville is our guest tonight. And how does Louisiana compare nationally with young adult health?
Well, Louisiana has higher than the national rate of mortality, homicides, and suicides among young adults, particularly among males. Then we also have, we're 45th in the country when it comes to obesity, the prevalence of childhood obesity. 45th, number 1 being the best. So we're actually on the more undesirable end of the spectrum when it comes to childhood obesity. We have almost 40% of children in the state that are considered overweight and or obese. Teen pregnancy is down, but of course Louisiana still rates higher than the national average.
There's a national initiative to improve adolescent health. Can you talk a little bit about that?
Great website. I look on it. I refer to it. It's a collaborative effort, actually, to improve the developmental health, safety, and well-being of adolescents and young adults in America. It's facilitated by the Health Resources and Services Division, Maternal and Child Health Bureau, Office of Adolescent Health and Centers for Disease Control, their division of adolescent and children health.
Now, there's organizations that come across to help young adults.
Yeah.
Can you give me examples of that, and how does it help?
Well, the organization sets benchmark goals for reducing serious health risks for young adults while promoting healthy habits nationally. So things as simple as reducing motor vehicle deaths, reducing illicit drug abuse, increasing or promoting vigorous physical activity amongst young adults. And this organization, they've developed an enormous amount of educational materials, course outlines, and different resources that you can refer to for further education of your young adults, young people, adolescents.
Okay, and I guess they could just punch up on the website. They could go to NIAH, and then it would come through. Or whatever.
Absolutely.
All right. Now, parents. There's a lot of parents watching, and you've listed a tremendous amount of examples of how parents can be vigilant. What can parents do?
Well, number 1 is start the dialogue with the child. Talk with your child. Simply talk with them. Make sure they know the dangers out there. But in order for you to be able to talk to them, you have to be informed. Start these critical discussions earlier rather than later. Let them know that they can come to you about any questions or concerns that they may have. And it's not only parents, it's parents, teachers, mentors. It takes a village. So, I mean, you just have to talk to your child. Another thing is just lead by example. Hey, I mean, show your child how easy it is to start exercising. Show your child that you shouldn't drink and drive by not drinking and driving. Show your child that smoking, abusing tobacco is unnecessary by not doing it yourself.
Right.
And you can use these resources, websites. The internet is a very valuable resource, and a lot of our young people, they use it daily. So using the internet is also a very great resource that you can use.
Told you we would sway from the agenda a little bit during the break. Synthetic marijuana, bath salts. You mentioned you've seen a lot of that. What's it doing to the youth?
Well, it's sad to say, but I'm seeing it on a regular basis and more often lately. What we have, we have young people to come in, and this synthetic marijuana, it's bought in stores as potpourri under different names, Matrix, Diamond, Kush, these kinds of things, and it's more potent than, it's almost 10 times more potent than regular marijuana, and it lasts longer. So I've had people to say, well, hey, you know, it gives me a longer high. I might stay high for 10 hours a day, or I might stay high for the entire day. And really this, I mean, so you come in, your heart rate is elevated, and your mental status is totally changed. And after using these drugs and while using these drugs, you really don't, you're not aware of what's going on around you, how you're hurting yourself or others. And it's just really something that I think that we as a medical community need to be more aware of and need to educate our youth about, because, hey, they buy it at a store, and like we said about earlier about over-the-counter medicines, you buy it at a store, you feel like it's safe, but it's not safe. It's not safe.
And there's no history behind it, so you don't know what the long-term effects will be.
That is correct. And when you use it for, it's actually used for potpourri. It's advertised as potpourri, but of course we're seeing people using it in other ways. And when you don't use it as what they are advertising it as, you really don't know what the effects, you don't know what the long-term effects are. And like we've said previously, what you do today will and can affect you for the rest of your life.
I'm definitely going to get you on for more segments concerning that.
Absolutely.
For more information, people watching tonight, where can they get more info?
Well, there are a few areas, few places you can go. You can visit the website at nahic.ucsf.edu, or you can call the Terrebonne General Medical Center Outreach Center at 985-876-7577. You can also visit the Terrebonne General Medical Center website online at www.tgmc.com. And of course, we hope you don't ever need emergency services, but if you do, we're here at the Terrebonne General Medical Center Emergency Department.
Final question. You seem so enthusiastic and into your work. Why did you get into that type of work?
Wow, emergency medicine. I think about it, and you are able to come in contact with so many people at such an acute state in life, when they're in dire need of your help, when they can't go anywhere else, or when they don't know where else to turn, and you're able to change lives at that state, and you're able to see immediate change. Sometimes you aren't, but for the most part, you're able to see some immediate change, immediate improvement. And I think about emergency medicine, and I think I wouldn't have done anything else.
Keep
I
that
love it.
enthusiasm.
Yeah,
And
I love
thanks
it.
for joining us tonight.
Thank
We
you so much
appreciate
for
it.
having me.
All right,
Thank
once
you.
again, Dr. Joni Clayville, we're going to take a break. When we come back, we're going to be in the Canada's Kitchen, so don't go away. It's all next on Bayou Time.